Welcome back, everybody. Colon cancer is one of the most deadly cancers in the U.S. But do you know some of the basics, like when you should be screened? Joining me now to talk a little bit about that is nurse navigator Susie Puryear from St. Mary's. And we've got a lot of questions to ask, things that people should know. March, of course, is Colon Cancer Awareness Month. And people need to know screening can be vital, a lifesaver, Susie.
Melissa, thanks so much for letting me join you today. So colon cancer is the second leading cause of death from cancer in the United States. There's about 55,000 people that pass away from this cancer, and it affects women and men equally. So it's really important to be screening. Early screening, if the cancer is caught in an early phase where it's localized, it hasn't spread anywhere, you have about an 80 to 90% survival rate, what we call, that you go back to your normal life. Unfortunately, only about 39% of the cancers are found in this stage. So if it's found in the later stage, then that drops down to about 12% that you can get back to normal life in that 5 years. So that's why it's really important to be screened and have your screening done early so we can detect it.
So what are some of the common warning signs?
Well, some of the common ones are if you have stool, or I'm sorry, yeah, of course you have stool, but if you have blood in your stool or on your stool, if you have a change in your bowel habits, if your stool changes shape, sometimes it gets skinnier, and if you have a lot of unrelieved gas, abdominal cramping, stuff like that. That's the most frequent warning signs.
And so who should be screened for colon cancer?
Well, interestingly enough, there's a trend that's going on in the last 10 years that people in the age group from 20 to 49, we're seeing a trending up of that they've been diagnosed. So right now, the standard is at 50, and if you're of average risk. Now, if you have a higher risk, it might be due to familial history, hereditary. It also might be your own symptoms where you might have irritable bowel or Crohn's disease, diabetes. But also if you're overweight, smoking increases the risk, alcohol increases the risk, inactivity increases the risk.
And there are ways to do it a little bit easier for screening. St. Mary's is offering it at-home screening as well. Tell us about that.
Yes, there's a kit called the FIT kit, and it's a kit that you take home and you put your stool in there, send it back, and then that detects cancer. And then there's the other test, which is the gold standard, which is a colonoscopy. And not only does that detect cancer, but it also, they can find precancerous polyps and get those removed and have those taken care of.
And we've got the numbers there on the screen too. Actually just disappeared. It'll be on our website if you want more information. Susie, thanks so much for being with us. We really appreciate it.
Thank you so much for letting me speak about it.
Thank you. And now we go to Tim with a quick look at our forecast. Hi, Tim.
Good morning to you, Melissa. We do have a lake wind advisory in that lighter shade of tan, also a wind advisory in the darker shade of tan. That's for this evening and tomorrow. We'll talk about it next.